Hello, my name is Abigail, and I am going to be talking about stomatitis and mucositis. So, oral mucositis can occur anywhere along the GI tract, and your mouth is part of your GI tract. So, typically, this occurs in patients who are undergoing chemotherapy or radiation because those cancer drugs target cells that are rapidly proliferating, and cells in your oral mucosa are rapidly proliferating. Here we see that about 40% of patients who undergo chemo will develop oral mucositis, so soft diet is advised. Risk factors: being female, smoking, tobacco or alcohol consumption, having another comorbidity like diabetes or chronic kidney disease, and having an unusually low BMI when you're going into chemotherapy. Signs and symptoms. The first sign or symptom that you'll see is discomfort and pain, and then you'll have the visible tissue change. You'll have some redness around the white lesion, but it will be a white ulcer with that red kind of ring around it. You can have shiny swollen gums and a burning sensation while you're eating, and that can be pretty painful. Moving on to stomatitis, there are two types of stomatitis. There is the oral herpes-related stomatitis caused by HSV-1, or there are the aphthous ulcers or canker sores, more commonly known as. So stomatitis related to HSV type 1. This is very common in children because children are always touching their face, touching all of the things around them. They don't know about good hand hygiene, and that is how HSV-1 is passed from person to person, is through physical contact. The viral particles will be present for life, so reinfection is likely. The ulcer or this cold sore will start out with an abnormal sensation along the lining of your lip, where the skin of your lip and your face meet. It's called your vermilion border. And what happens is there'll be some burning, a tingling sensation, some redness, some inflammation, and then you'll see the appearance of a blister with clear or yellow fluid inside. Whether you rupture it or not, it will spontaneously rupture eventually, typically about 3 to 4 days into this, and that exudate can also infect others, and this is why with children it spreads so easily, because they touch everything. Eventually a scab will form, and it takes about 10 to 14 days for this to heal entirely. But we know that the viral particles are still in your body. So here we see different ways that it's spread: kissing, oral sex, sharing utensils, or transferring that exudate like I mentioned earlier. Moving on to aphthous stomatitis or canker sores. These are idiopathic in nature, ironically, even though they're so common, but we do see an increased incidence in young females. There are risk factors: oral trauma, stress, certain foods. Now, these foods are not allergies, they're just foods that can irritate the lining of the mouth. And also, H. pylori infection puts you at risk for developing these canker sores. It is a shallow white lesion on the tissue of your mouth. It's not contagious, it's self-resolving, but it is very painful when you're eating, and it is thought that perhaps these are caused by a diet that is lacking in vitamin B12, zinc, folic acid, or iron. And now Winter will talk about seeking treatment for these.